and welcome from wherever you are to Healthcare Excellence Canada's webinar series on enabling aging in place. I'm Andrea Piché. My pronouns are she and her, and I'm pleased to be your host today. As you join, I invite you to say hello in the chat and share the name of the ancestral lands that you're joining from. For those of you who haven't joined this series before, the Enabling Aging in Place webinar series aims to explore a wide range of topics and share success stories and lessons learned for initiatives that support older adults to age at home with the right supports. The topic of our webinar today is collaborative community support, measuring value through social return on investment. We are pleased to offer French simultaneous interpretation by Boost Events, a subsidiary of Boost Lingo, for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. And if you don't see it there, you might notice a little ellipsis with 3 dots in the middle. That's a more menu, and from there you'll be able to select the interpretation. If you need support at any time during the webinar, you can reach out to tech support using the direct chat feature. We also invite you to share your questions and comments at any time using the chat box, either in English or in French, and we'll encourage all of you to respond to those comments and answer questions as you wish. We're going to try and connect as many of your questions as we can with our speakers at the end during the question and answer session. If we have more questions than time, we'll send a follow-up response as part of our post-event email for follow-up. This session is being recorded, and we'll share a link to the recording in the coming weeks. I'd like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I'd like to acknowledge that I'm joining you from Grimsby, Ontario, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Ojibwe Chippewa peoples covered by the Upper Canada Treaties. Where I live right now, the signs of fall have started to peek out from behind the leaves. I live near an escarpment, and it has a nice tinge of color, and the apple and pear trees are really full and heavy. Our Indigenous ancestors, they marked this harvest season with festivals and celebrations, a time for slowing down and celebrating the abundance of the land while working as a community to harvest and store food for the winter. For me, September always feels a little more busy. It's a month with many new beginnings, and so I'm grateful for the reminder of the importance of community and celebration, of the abundance that we have, and this is what I'm really hoping that we can honor in the theme of today's webinar. If you haven't had a chance to already, please do introduce yourself in the chat. Let us know where you're joining from. And thanks to my colleagues in the background who are going to add the Native Land website in the chat if you want to learn more about the territory that you're joining from. Also, since I know some folks can't always stay till the end, if you learned something valuable today or something is shared that you just really needed to hear today, there is no better offer of gratitude to our speakers than to pop your key takeaways or insights of importance into the chat before you go. And we'll be sure to save the chat for our speakers. And now it is my pleasure to introduce our speakers for today, Helen Lightfoot and Ann Miller. Helen's background is in social work and community engagement. She's a senior practice consultant within Assisted Living Alberta in the Connecting People and Community for Living Well initiative. Using an asset-based approach, she works with a rural multi-sector community teams to support the well-being of local underserved populations. And Anne is the principal consultant at Constellation Consulting. Anne has a master's in public policy and public administration with a focus on leadership and decision-making. Anne is a credentialed evaluator through the Canadian Evaluation Society and a Level 3 accredited SROI practitioner and licensed SROI trainer through the Social Value Network International. Anne has conducted research, evaluation, and SROI analysis in fields such as food security, sexual exploitation, youth at risk, housing, collaborative health, and seniors care. Welcome, Anne and Heather. We're so glad, Helen, we're glad that you're both with us. Nice to see you. Come on in.
Thank you.
And I'll turn it over to you both.
Thanks so much, Andrea.
Great. Yeah, welcome everyone. So excited to be talking about this today. So we'll be talking about the social return on investment methodology. If we go to the next slide, we've got, I think, or the slide after, we've got a bit of an agenda. So we'll just do a quick round of introductions. Thank you so much, Andrea, for the lovely introduction. We'll do an overview of what the social return on investment methodology is, and then we'll go through a couple of examples of how it's being used within the sector to understand the value of different types of community initiatives that support older adults in the community. One of which is being led by Helen, so she'll give some more details on that. And then we'll have lots of time for questions and discussion, because I know it might be a bit of a new methodology for folks. There might be some interesting questions that come out of, of what we're able to present. So if we go to the next slide, I'm the principal consultant at Constellation Consulting Group. We do all things research and evaluation, program design, all that sort of stuff, with a specialization in social return on investment analysis. As Andrea mentioned, we're connected with the Social Value International Network and also the Social Value Canada Network. So if folks get interested in SROI today, one great place to have some additional resources to look into training, to sign up for webinars is Social Value Canada. So you can look them up, and I'll make sure that resource gets sent out with the slides at the end. You can go to the next slide for Helen.
Thanks so much, Anne. So I'm the lead for this initiative. We're Health Canada funded, but live within Assisted Living Alberta, which is one of the new organizations in our healthcare system in Alberta. We had an initial grant in 2020, did a lot of research at that time. And as we were pulling things together, a key component is having different sectors working together in our initiative at that community level. And so that's where we really turn to look at that social return on investment. What does that investment mean for all those different partners that are part of this work? And so that's where we investigated, finding out about Anne and her group. There aren't a lot of experts in this field, is what we found. And so we were thrilled to find an Alberta partner to be able to build with that. Thank you.
Great. So let's do a quick overview of SROI. So if we go to the next slide, social return on investment analysis is a bit like doing a cost-benefit analysis, but it's also different in a few ways. One of the big ways that it's different from a cost-benefit analysis is that we're not just looking at sort of economic value within a system. It's sort of looking at a broader conception of value. So looking at ways to translate social change and social value into the language of financial returns, looking at ways to incorporate things like environmental value into that value proposition statement, so that we're having a broader capture of the value that's happening because of an investment. It's also a little bit different in that it's very stakeholder focused. So we're not just looking at, value back to government or value out into the economy. We're really focused on what's the value to the different stakeholders who experience change because of an investment or an initiative. And so you might see within an SROI analysis, some outcomes valued kind of almost twice, but for different stakeholders. So there might be beneficiaries who are experiencing value, but that might also create value for the government. And so it's sort of capturing the fact that it's not just value to one particular stakeholder. It's also a little bit different than a cost-benefit analysis in that we're able to capture the value of avoided alternative outcomes. So it's not just about you go through, you make a change, and it's the value of the change that happens. It's also saying, so if we didn't do the things that we're doing, what would the situation look like? And is there a value to avoiding that situation? And so we're able to draw that into this broader capture of what the value is looking like when we're doing an SROI analysis. If we go to the next slide, SROI is an internationally standardized methodology. The Social Value International Network sets out standards of practice. It's a principles-based approach, and it usually follows these 6 steps. And these steps, if anyone has done sort of program evaluation work, The first few steps are very similar to what you would do when you're doing a program evaluation, and then it kind of goes off into the world of SROI. So if you're already thinking about program evaluation, or you're doing some program evaluation work or have done, it can set you up really well to sort of move into this next step of potentially doing a social return on investment analysis. So the first step in an SROI analysis is establishing the scope and identifying stakeholders. When we're talking about the scope of an SROI analysis, some of the key things to think about are the time frame of the analysis and the investment that you're going to look at within that time frame. So sometimes when we're doing an SROI, we might look at more like a program time frame. Like if it's a school-based program, we might just be looking at that school year because that's when the investment is happening. There are other initiatives where it's a multi-year initiative and we have a broader time frame because we need to capture all of the investment that's creating the outcomes. So that's a big part of this establishing scope piece. At this point, we would also consider whether we have enough data to do a fully evaluative SROI analysis. So we've got enough information coming back from whatever the initiative is to be able to use that evaluation data to populate the SROI model and have an evaluative SROI, or whether we maybe need to be doing a forecast SROI where we're building on things we know from the community, information that we have, past research to be able to forecast what the value might be, or whether it might be a blend of both. So there are many instances where you've got most of the data, but there are a couple of outcomes that are really important, really valuable that maybe you don't have the data around. That doesn't prevent you from doing an SROI, but it might result in more of an evaluative / forecast SROI analysis where you're forecasting some elements, using evaluation data for others, and then working to evolve your evaluation systems to be able to have all the data you need to do a fully evaluative SROI in the end. So that's sort of where we're at this point with the Connecting People and Community for Living Well project that Helen's leading. We had done forecast SROI, and now we're working to sort of evolve it, or it was sort of forecast / evaluative. We're working to evolve it into a more evaluative SROI at this point. In this first step, we're also looking at who the different stakeholders are that'll be included in the SROI analysis. And in the first step, sometimes we have a really long list of different stakeholders that we could potentially include. And as we work through the process, that might get sort of pared down a little bit based on who's actually experiencing change, or the fact that that change is particularly valuable. But at this first step, we're really looking to make sure that it's grounded in that stakeholder piece so that we're understanding value from different stakeholders' perspectives and not just sort of looking at one conception of value. The next step is similar if anyone's done sort of program logic models. It's similar to creating a program logic model where we're mapping the links between the activities that happen and the outcomes that emerge from those activities. And we're doing this, it's a little bit different than a program logic model in that we're doing this on a stakeholder by stakeholder basis. So as I mentioned previously, you might actually see like, you know, people impacted by the program or beneficiaries of a program experiencing an outcome. And then you might see something kind of parallel under a government stakeholder where, because of the change that happens for people in communities, the government has, or government systems might have some change as well in terms of who's accessing what services. So yeah, we go through most of the outcomes that end up included in an outcome map for an SROI analysis are usually sort of short to midterm outcomes, because that's where the value is typically being initially experienced and measured and captured. But sometimes you might see some of those longer term outcomes included in there as well. Then the next step is kind of half evaluation, half SROI. So we start with evidencing the outcomes. So understanding how many people might experience each outcome, or to what degree each outcome is happening. That's sort of where we're looking for that evaluation data, understanding the change that's happening in communities. And then we're moving into sort of SROI world where we look at the value of, or how we can represent the value of each individual outcome. So some outcomes might have sort of intrinsic value of their own and more tangible value, like someone gets a job, they have increased income, and the value of that outcome might be the increased income. Other other outcomes might have more intangible type value, where we're looking at changes in well-being or changes in mental health and things that might not have an intrinsic financial value. And so we're using different techniques at that point to assign financial value using financial proxies to represent the value of the outcomes. The next step is what I consider sort of the taking a step back step, where we look at each outcome and consider whether or not the change would have happened anyway, whether or not we've inadvertently displaced positive outcomes while creating this other positive outcome, or whether there are potentially negative things emerging because of the creation of the outcome. We also consider whether or not the outcome was entirely because of the investment or initiative that we're looking at, or whether we need to consider attribution to other players sort of in the system. At this point, we also consider how long the outcome might last. So after the initial investment, how long it might last into the future, and whether it drops off over time. So once the outcomes happened, whether, and if we're considering that it continues into the future after it's happened, whether there's some drop off over time. So maybe you've got a smoking cessation program, you've got 10 people who quit smoking, and 5 years from now, only 4 of them are still not smoking, then we might have a 60% drop off over 5 years. So we sort of start considering those elements at this point. Then in the 5th step, we do the actual calculation of the SROI. I have another slide on it as well, but it's basically sort of adding together the value of all the outcomes across all the stakeholders, minus those discounts from the 4th step, and dividing by the total investment that we're looking at for the period. And at the end, you get a ratio that says 1 to say 5, which would indicate that for every dollar invested, you're getting $5 in social, economic, and environmental value in return. And then the final step goes back to sort of what you would do in a program evaluation or research project, where you're reporting it back out using the tool, embedding it into practice so that you can see the change in value over time. If we go to the next slide, I have some thoughts on some of the benefits and, a little more on the ratio. Yeah, we can go to the next slide. So again, it's the total value of all the outcomes over the total investment expressed as 1 to something, indicating that for every dollar invested, however much is created in social and economic value. Okay, now we can go to the next slide, because I have some thoughts on the benefits of using SROI, also the limitations. Some of the benefits I would say are it creates a really good communication bridge with people that are mostly speaking those financial and numbers sort of language. It helps to translate that social change work and the value of social outcomes into a language that those types of stakeholders are really interested in. I find sometimes speaking to board members or government members, it can really be a great bridge into telling the full story of a social change initiative. It's fairly easy to grasp. It does get into the details of how a program is working, and so it can highlight where you're creating a lot of value or not, or where you're achieving outcomes or not, similar to a program evaluation. I like that it's very stakeholder focused, so we're not glossing over the fact that the value that we're seeking to create it should be for the people benefiting from services. Yeah, I like that that's included and embedded within the methodology. I also like that it is that broad conception of value, so value to those different stakeholders, not just in financial terms, but in terms of like social value, environmental value, all those pieces, which leads to valuing things that might otherwise go unvalued or undervalued, and being able to highlight that value in a bit of a different way. And sometimes funders are looking for this information. It can be really helpful to share it with funders or philanthropists who are interested in, this financial language around the benefits of social intervention. On the flip side, let's go to the next slide. Yeah, the limitations, as I'm sure, as I was talking through the methodology, I'm sure some of this was sort of percolating in your mind, or if you've had exposure to SROI in the past, it can be very subjective. You do get like a number at the end, which seems really solid, but there are so many decisions that go into how that number is calculated that it can be a lot more subjective, I think, than people really realize. There's the potential for overclaiming the value depending on how you value different outcomes or assess different outcomes. There's also the potential for undervaluing some of those outcomes. So I feel like there's sort of the idealist view where it's like we're going to value social value and social outcomes and changes in well-being, but when it gets down to actually assigning appropriate financial value to those changes, it can be a lot more difficult, and we might end up undervaluing things like changes in well-being, value of a life, those sorts of things. And there's the potential for misrepresentation of how stakeholders are actually experiencing value. When you finish an SROI, you get kind of a wild spreadsheet with a lot of data in it and a lot of calculations, which I feel like can lead to a lack of transparency within the methodology, to be honest, where people look at it and kind of gloss over or can't get into the level of review or detail that would lead to greater transparency. So I think that's a limitation in the methodology. And then there just isn't a lot of, as Helen sort of alluded to, there isn't a lot of SROI experience in Canada. We don't have like a database for financial valuation, that sort of stuff. So I think that sort of limits how we're using this type of methodology in a Canadian context in particular. Yeah, so we'll jump to the next slide. We're going to start going through some examples, and I'll pass it over to Helen for the next slide for an overview of the Connecting People and Community for Living Well initiative, which is our first SROI example.
And yeah, I decided I'd share the model that we use for implementing our initiative here. We work with rural teams that are comprised of health, community, and social partners to bring them together to work, make decisions, set priorities, and build supports for underserved populations in their communities. Initially, we focused on people living with dementia and caregivers, but we've expanded to a few other groups also in our second round of granting with it. At the center of it is well-being and looking at impacting well-being for individuals within the community, but also for those teams that are coming together to do the work. Really believing that if they are well supported, then they are able to implement those supports within their community. You'll see the 5 elements of the model there. I'll just touch lightly. Our provincial support started as our grant team, but really now has incorporated other partners provincially, including Healthy Aging Alberta, Alberta Association on Gerontology, Caregivers Alberta, some of those things, and that helps to build that support across the province for the teams. Of course, we have the communities who are actually working on it. That's where the rich knowledge lies. They know what assets are in their communities. They also bring the voice of lived experience to the work, providing a way to give input or even participate on those teams. In those 10 core principles, the one I really want to highlight is that it's community driven. We're there to facilitate and mentor, but they're the ones leading the charge. Our well-being guide is a resource that we've developed that we work with the teams. And now we are ongoing in the 5th area of identifying learning areas for the teams to be successful, but for us as provincial partners, as well as for our system partners. And I think when we see all 3 of those partners lining up in understanding asset-based community development, person-centered care, then that's when we see a lot of advancements happening within this work. So that's a really general quick overview, but I'll hand it back to Anne now for how we work together on the SRI.
Awesome. Thanks so much, Helen. So back in 2022, we started working on this SROI analysis, or we might have started in 2021, and then we ended up looking at the Connecting People and Community for Living Well initiative over a 1-year time frame. So we did a more forecast analysis based on some evaluative data that was already existing from the project. It was based on implementation of the initiative in a few different communities: Drumheller, Innisfail, Stony Plain, Three Hills, and Westlock, so some rural communities in Alberta. We looked at the investment and outcomes that were created from that investment over the period from March 2022 to March 2023, and mapped within the analysis as stakeholders were people living with dementia in rural communities, so one of those direct sort of beneficiary stakeholders, and caregivers for people living with dementia in rural communities, again, sort of more direct beneficiaries from the initiative. And then the members of the multi-sector community teams that the initiative is working with. And so these are really sort of the core stakeholders within the analysis and within the work of the initiative. Then we also looked at some of the spin-off effects of the initiative on, other community-based organizations within these communities, the communities themselves, and then the government systems and services that different people are accessing or interacting within as part of this or as stakeholders within the analysis. So if we go to the next slide, for mapping the outcomes, we took a look at existing research on the types of outcomes that might be emergent from this type of work. We reviewed the past assessment of value that was undertaken in the beginning sort of phase of the initiative, where they did a more return on investment study, just looking at sort of healthcare interactions. And so we sort of leveraged some of the information that had already been created for that study, including some estimates around how many people within these communities might be living with dementia or caring for someone living with dementia. We looked at some of the evaluation work that was already going on within the initiative to understand some of the perspectives of different stakeholders, and got some feedback from some multi-sector community team members. And we spoke with Helen and her former counterpart, Sharon, around what they were observing on the ground. So if we go to the next slide, for example, for the people living with dementia in rural communities, some of the outcomes that were included in the SROI and ultimately valued in the SROI included things like increased well-being from increased access and ability to engage in programming and activities based on that work of the multi-sector community teams, things like increased recognition of their strengths and contribution, those sorts of things, increased ability to live well in their own home and community longer because of that more comprehensive and understanding level of support that they were receiving in communities. So if you go to the next slide, we then looked to understand how many people might be experiencing the different outcomes that were included in the SROI map. We used, again, existing research, some of that data that was already included in the ROI study, some of the evaluation data that the initiative was already capturing, and then some conservative estimates or forecasts where this initiative was sort of doing innovative things that wasn't already informed by existing research or hadn't already been captured by evaluation data. And that's where we're sort of seeing this analysis as more of a forecast analysis. And as the initiative has continued and expanded across the province, we're starting to evolve into a more evaluative model where we're working more closely with the evaluation team to make sure we're capturing some of the information that we'll need to continue to do this SROI work. For valuing the outcomes, we looked at some similar SROI studies. We looked at the past ROI valuation. We looked at publicly available cost data, like some health system data. And that all ended up integrated into the SROI model. So if we go to the next slide, then we went through and did all that discounting. We used some of the evaluation findings and existing research again, and in many cases there were sort of reasonable estimations made and then sensitivity tested. So if we weren't convinced that the outcome was entirely due to the initiative, we included a discount on the value of the outcome, and then we sensitivity tested whether or not that estimation was sort of wildly skewing the results somehow to ensure that we weren't making unreasonable estimations within this sort of step of the SRY analysis. And if we go to the next slide, we get the fun part, the results. So the results from the analysis revealed that in 2022-2023, the initiative was creating over $6 in social and economic value for communities, for our province, for all those different stakeholders that were listed in that scoping piece that I went through. If we go to the next slide, we can see sort of how that value is, how that value is breaking out across different groups. So there is a lot going back to those publicly funded services and systems, healthcare systems, all that sort of stuff. But there's a lot of value going back into community to community members and being experienced by those different community members. The nice thing I would say about being able to break it out in this way is that we're able to sort of say to government, oh, there's this return for you, but that's not the whole story, that it is also about how communities are benefiting and the value that's experienced within communities. So we have one more example as well that I can go through here. That's sort of a different approach to working with an aging population. We used an SROI methodology with the Brenda Strafford Foundation here in Calgary to take a look at one of their long-term care homes that has a lot of like research integrated sort of features and innovative features, and the facilitation of an adult day program, not necessarily for long-term care home residents, but for community members to come and experience benefits and interact in a different way. So if we go to the next slide, I don't know if Helen, you wanted to speak to this or you want me to speak to it? Yeah.
Sure. I just wanted to share that the Brendan Stratford Foundation really covers a broad range of the types of activities that they do, and they've got their four kind of headings there of the different areas. I had been involved with them before because they had a grant and developed material around dementia-friendly communities that actually many of our teams use now still with that. But this SRI really focused on the Beauview Manor and their adult day program.
Great, thanks, Helen. So if we go to the next slide, we'll take a look. So this analysis was more of a blended evaluative and forecast analysis, where most of the information was evaluative information. Then there were a couple of outcomes that were more in that forecast sort of situation. So we looked at when they first approached me, they were like, we want to talk about the value of kind of everything that we do. And in the end, we decided to do one case study on one of their long-term care homes, because they do have some different innovative features about how they run their long-term care that creates value for the folks that are entering their care homes. And one of the things that they wanted to highlight within this analysis was the value add of facilitating an adult day program within the long-term care facility for community members to come and experience some of the programming that was going on in the home, and sort of draw upon the experience that the Brenda Strafford Foundation has to enable healthy aging and and socialization and different things like that. So within this analysis, we had two sort of direct beneficiaries mapped in as stakeholders. So those long-term care residents and the adult day program participants from the community. And then as sort of connected stakeholders, we had the families and caregivers and loved ones of the participants and residents. Then we also spoke with a number of volunteers and understood that it is a very unique volunteer experience. And so they were mapped in as stakeholders as well. And then government services and systems, because most of their funding comes from Alberta Health Services, they were sort of highlighted as one of the government services and systems that they wanted to make sure were sort of called out within the SROI analysis. And then obviously the funders and donors making the whole initiative happen. Then if we go to the next slide. So for this analysis, we again looked at, we always do a big literature review to see what other initiatives are doing, what information's out there around outcomes. So we looked at existing research. The Beauview Manor has a lot of information on what's happening with residents and with those day program participants. So we were able to draw on a lot of the assessment metrics and different things that they were collecting. We talked to leadership team members, and then we did a bunch of stakeholder engagement. So we did one-on-one interviews with family members and volunteers, and then we had some different group discussions with adult day program participants and residents and family members of residents at Beauview Manor, which really helped us shape what the outcome map looked like and also helped to inform how we are valuing outcomes and evidencing those outcomes. If we go to the next slide. So a different example of the types of outcomes mapped in this SROI analysis. So for the adult day program participants, outcomes like maintained or improved quality of life / reduced rate of decline in quality of life, so that people are able to live their best life for as long as possible. In speaking with stakeholders, this was one of the pieces that really came out was it's not even about necessarily maintaining or improving quality of life, but sort of mitigating risk around the decline in quality of life. So I thought that was an important piece that ended up sort of integrated into the analysis throughout, is this reduced rate of potential decline. And we had pieces around physical health and mental health and social health. So all those pieces were mapped in. If we go to the next slide, to understand how many people were experiencing these different outcomes, we had quite a bit of evaluation information, like around resident experience surveys, those sorts of things. And then we also drew on some particular studies, and it was informed by all that stakeholder engagement that we did. Now, if we go to the next slide, valuing outcomes, again, we were looking at some of that publicly available cost data and previous studies. And then because we did quite a bit of stakeholder engagement, we were able to get people to articulate what was most valuable for them, so that we were able to sort of ensure that that was appropriately valued within the SROI analysis. And in the next slide, we went through and did all those discounts, and sort of based on, again, research and evaluation findings, and in cases where we didn't have the information, reasonable estimations that were sensitivity tested. So then the end result of this analysis indicated that for every dollar invested in Beauview Manor as a whole, so both the long-term care work and the adult day program, about $2.50 in social and economic values created. If we go to the next slide, this is broken down again across different stakeholders. So quite a bit of it, again, goes back to government services and systems, but all those stakeholders that were mapped in do experience different portions of the value that was sort of demonstrated through the SROI analysis. And if we go to the next slide, we did a little bit of extra analysis within this case study to look at that adult day program specifically, because they were finding making a case for that funding for that specific program was becoming more and more difficult to be able to justify the use of their space and the funding that was going, and the time and everything that was going to facilitating this adult day program. So we looked through the SROI analysis at sort of the value add of having the adult day program in Beauview manner, so the proportion of the SROI ratio that was being generated by outcomes from the adult day program. So looking in that way, we saw that there was sort of a 22% value add from this program, which is, I think, helps to really demonstrate the value of that community connection. And then breaking out the two components of the programming going on in Beauview Manor, so the long-term care and the adult day program, based on how much investment is going into each program and the outcomes experienced from each component. There are sort of two different SROI ratios that emerge. So the long-term care still has a positive SROI ratio of 1 to 2.16. But the adult day program, because it's quite low cost to facilitate and and to advance, and because it has a lot of broader benefits for community members, has a really high SROI ratio in and of itself of 1 to 8.96. So they were able to sort of demonstrate in this way that the adult day program contributes value to Beauview Manor in a really cost efficient way. And so I think that kind of helped them make a bit more of a case to be able to have that community connection on an ongoing basis, which was a neat sort of feature of this particular example. That's it. That was it for the the presentation. We would love to hear your thoughts, questions, ideas. Yeah. Thank you everyone for already. I saw some, different pieces going on in the chat. So thank you so much.
Thank you both so much. I think folks are really connecting with this content. Lots of love coming in the chat. Folks saying that they feel like this is the future of evaluation. And I think what we're hearing and seeing in the folks that we're working with in the aging in place space is that a lot of folks are working in the community setting, and they know that the impact is there. Right? They know that it's really having an impact on the overall health and well-being and quality of life of the people that they're working with. They know that it's impacting volunteers. They know that it's reducing the amount of health services that are being utilized. They just don't know how to quantify that. They don't know how to communicate that in a way that folks who are typically used to receiving financial type reports can relate to. And I feel like this is the bridge, and that there are a lot of folks who are really excited because they see themselves in this work. So yes, and questions have been coming in. One was already answered in the chat. So the first question that came in was, would you say, when you say similar SROI studies, are these ones that you completed yourself, or that your company did, or they published reports and articles? And then Helen graciously answered the question that these were published articles, and some of them included work that was yours. I don't know if there's anything you wanted to add on to that question.
No, I think just because there isn't as much SROI work going on in Canada, I find it very helpful to do a big search every time to see if other people have been researching values within our communities, to be able to build that community of practice. Yeah, and so again, I would encourage people to connect with Social Value Canada to understand some of these examples. There's a lot of work on SRY going on in the UK, and so sometimes we're taking a look at those models, even to just understand how outcomes are being mapped or how they're looking for value. So like, was value, for example, in the Beauview Manor SROI for caregivers, there was an outcome around sort of reduced caregiving strain and time and commitment and stress. And so we looked to represent that value in terms of what it would cost to otherwise pay for respite care. Whether or not people would actually pay for that is sort of beyond the point. It's looking at, what's the value of that in our community, and how is our economy valuing respite care and that experience of respite. So yeah, that idea came from an SRY in the UK. So that's where we're sort of drawing on ideas or actual values from other SRY studies. Sorry, that was a long answer to a question that was already kind of answered.
No, I think that you highlighted some important additional context that I think is really useful for folks. I'm going to go a little bit more quickly because the questions are coming in sort of fast and furious, and people are really interested in getting into the details. Someone has asked, can you recommend a course or an activity or an example with numbers for those new to SROI to practice before trying to use it with real programs?
That's a great question. I would look to Social Value Canada or Social Value International, with the caveat that depending on the trainer, you might not get the numbers piece. You can also, let me think, in the follow-up email that we send, I can send like a blank training SROI spreadsheet that you can play around with to see how the numbers work or see how you're putting the numbers in. Yeah, my consultancy, we also can do like tailored training, like if you want to go through how we're actually calculating things. That's something that we offer if you want to connect afterwards. But yeah, I would look for training. I would look to Social Value Canada or Social Value International because they often have different types of trainings that they're bringing up, like from intro all the way to advanced or new valuation techniques and things like that.
Perfect. That question was for Madison, and she's already responded that that would rock. So looking forward to sharing that resource with our post-webinar email. The next question is, what's the expected range of financial commitment for a community of about 1,000 people to facilitate an SROI?
Yeah, I think that's a really difficult thing to answer without knowing more details about what you would want to assess. Sometimes SROIs can be done really cost effectively, depending on if you have capacity within your community to get the data or do some of the research and stuff, like if we partner in that way. So it can be as low as $3,000 maybe, and then it can go as high as like $50,000. So it sort of depends on the initiative, depends on how much work a group is able to take on, or like in terms of data and mapping and stuff. Yeah, sometimes I also work with groups just in sort of a coaching capacity where people do most of the SRY work themselves, and I just sort of help them frame the SRY and double check things and provide data sources and stuff like that. So sometimes those types of services can reduce the costs if most of the SRY is being done in community. Yeah, but it can be a bit cost prohibitive, I would say, for some communities. Yeah, just because the expertise isn't necessarily there, or the time to be able to become an expert or sort of deep dive into the methodology.
Thanks for sharing that. Thanks for being willing to put some bracketed numbers, realizing, for some folks, that's a very wide range, 3,000 to 50,000. But I do think that that is the reality in any type of evaluative work. And also just reminding folks that HEC has a number of initiatives going on right now that folks can apply to for funding. And I'll talk about them at the end, the Enhancing Integrated Care, the Right Care Challenge. And so, in partnering with HEC and participating in some of these programs, that is a way that, if you receive funding, you can direct funds to those types of activities. So that's a great way to sort of kickstart your evaluation components if you're into an initiative that aligns with the program that we have going on. So, do take a look at our website and look for those opportunities. The next question is, when doing SROI provincially, such as the dementia project you did, how do you take into account differing sizes of populations, or does that have an impact, rural and urban?
Do you want to speak to this, Helen, or do you want me to jump in?
You get started on it, yeah.
Sure. Yeah. So when we're doing SROI, it really is tailored to whatever the initiative is, or the community. So like an SRY done within a rural community wouldn't look the same necessarily, or wouldn't have the same valuing of outcomes and things as it might in an urban community. Like I know I've done some in smaller rural communities, like in northern Alberta, where the cost of an ER visit isn't anywhere near the same as in an urban community because they're flying by helicopter to get to a hospital. So there's just different costs and different values that emerge in different communities. So we try and tailor it as much as possible. In terms of the dementia, the Connecting Communities for Living Well project, we really looked at those specific communities that were already implementing the project. So it wasn't looking at sort of the whole province all at once. It was looking at each of the communities, and the ROI study that had been previously undertaken pulled data from each of those communities, like in terms of dementia rates and healthcare use and things like that. So we were able to use some of that information. So we do try and tailor it as much as possible to local community contexts, just understanding that outcomes could be different, values could be different, the number of people experiencing outcome could be really different depending on how an initiative is undertaken and with which community it's happening.
Yeah, I'll just add to that, that outcome part is really key. In our initiative, our focus is on well-being, so we aren't looking at health outcomes all the time or exclusively with that. And so I think defining those outcomes it was really key in terms of understanding that return on it, as well as the inputs with it. We measured the impact for publicly funded systems, but actually the funding, there wasn't really funding from those systems for the work that we're doing. The work that happens within those teams are off the side of their desks. And so it's kind of a unique perspective in terms of great impact for those publicly funded systems, but actually the investment from them directly was pretty low for the initiative itself. So we're able to tell that story by sharing that.
Thank you. I think that answers it pretty comprehensively. I've got a couple more questions here, and just also pointing you, if you're not seeing the chat coming in real time, folks are sending gratitude and appreciation for everything that you're sharing, and looking forward to reviewing more materials. The next question is, can you provide more detail around how you assign value to subject feedback from surveys and interviews?
So like the financial value piece, or how it's integrated into the SROI. So I guess I'll answer it in
either way. And then I think Suzanne may have posted that question, and welcome you to clarify in the chat, and I'll try to connect that with Anne as well.
Yeah. And so yeah, when we're doing some of that subjective feedback piece or getting some of that qualitative feedback, we're using that usually to help shape what's included in the outcome map, and make sure and sort of validate that we're valuing the right things in the outcome map. And then sometimes we're asking people, in these case studies we didn't, but in some case studies we're asking people, how much could you imagine paying for a service like this, or paying to achieve a particular outcome? Or how much could you imagine paying to avoid a different outcome? Or sometimes there's a technique where it's like, okay, if you had $100 or 100 beans and you could allocate them to these different outcomes, how would you allocate those, to understand where people are feeling they're getting the most value from different outcomes. I would say in my own practice, when doing those types of techniques, I mostly use it as a way to make sure that we're valuing the right things within the SROI, or making sure that we're not missing anything within the SROI, because I do find it's really difficult for people to assign a financial value to outcomes that they're experiencing, as I'm sure if you imagine it yourselves. Yeah, it's hard to say how much you would pay for something, particularly when we're working with populations that maybe don't have the means to pay for something. It's like asking that question can be a bit of a moot point, like it doesn't really make sense to folks. And so usually I'm asking questions more like, what was most valuable to you in this initiative? Or if we have a list of outcomes, like, do you feel like you experienced A, B, C, D? Which were most valuable, or did you experience what was most valuable for you? Or yeah, those sorts of questions. Unless you have like a really big sample size, I would say that asking people to assign a value to something isn't necessarily going to provide the best data for an SROI, just because you do get like typically a huge range of different things, or people being like, well, I don't know. Yeah, so that's sort of how
Yeah.
we used it in these case studies. I hope that's the question that was asked.
Yeah, Suzanne's response, excellent, thank
Oh,
you.
great.
And actually, I'm wondering if I can add a tag-on question to that, which is, I know a lot of folks collect feedback from the people that they support on a regular basis. And so how might somebody sort of shape the questions that they ask in those evaluations in order to have their regular data feed nicely into an SROI?
Hmm. Yeah, I think if you're building evaluation systems or you have evaluation systems and then you're thinking about doing an SROI, really it's about like the outcomes that people are experiencing, so the actual change that's happening, not things around like program satisfaction, although that can be an indicator of some different aspects of programming, but usually it's more around like the change that people are experiencing. So if you're asking questions like that, when I'm engaging with stakeholders, yeah, I often ask them like what was most valuable. I also often ask, what would your situation look like if this intervention didn't exist or if this program didn't exist? Because I do find that can be very indicative for an SRY around like the outcomes that you include in the outcome map or the things that you value. So if people are like, oh, if this wasn't the case, I'd be so stressed, or if this wasn't the case, I would, you know, be worried about losing my housing or different pieces, then it can really help highlight the avoidance of those alternative outcomes and how many people might have experienced those outcomes otherwise, because that can be a really hard piece to try and capture data around because it's a lot more speculative. But I do find asking people that question can be very helpful, because people often have a very clear picture of like, this is the dire situation I might have experienced if I didn't get this help. Or this is the path that I was sort of going down, and this intervention sort of set the path a little bit differently. So
Thanks. That's very practical and helpful advice for building evaluation tools. We're getting to the end of our time together, and so as we transition, and I'm going to share a bit of information about some upcoming events at HEC, I invite you to pop your ahas, your gratitude, the thing that mattered to you that you needed to hear today, anything that you want to connect the speakers with in terms of your feedback. Please share that in the chat, and that will be a nice offering up to Helen and Anne for their time
and
sharing
thank
with
you
us
everyone
today.
for coming in for the great questions. Honestly, it was a real honor to be able to speak to this group today.
We're so happy you're here. Thank you. If we could pop over to the next slide quickly. So just sharing that. Well, before we get to Care Forward, I don't know if any folks have seen this on the screen in the background, but we're getting excited for Canadian Patient Safety Week here at HEC. All Voices for Safer Care is our theme. Lots of work around being inclusive and ensuring that care providers, patients, residents, community members, everybody has a role to play in patient safety. So look in the chat and you can sign up for Canadian Patient Safety Week to get resources and invitations to events. And also our Care Forward program, which has launched, has some new programming that is open for application until October 31st. So one is called Enhancing Integrated Care, and the other initiative is called the Right Care Challenge. Both of them provide opportunities for expert coaching, resources, virtual learning, networking opportunities. Through Enhancing Integrated Care, there you can receive up to $10,000 in support. So as we were talking about, what can we use those funds for? SROI, absolutely. And the Right Care Challenge has monetary awards that go through the length of the offering. Enhanced Integrated Care also has a webinar coming up on October the 2nd. So if you want to just learn more about what that program is about, please register via our website. Next slide. And then mark your calendars. We have only one Aging in Place webinar left, November 26th. The topic is still unfolding, but it's looking like it's going to be a beautiful conversation around the future of aging in Canada. And so I look forward to being a part of that with you. Finally, we would love your feedback. Just a very quick couple question survey to help us understand the value of this webinar for you. So thank you all again. Thanks for being with us. Stay connected, stay well, and look forward to seeing you next time. Take care.